I haven't checked the numbers for a long time, and yesterday when I was preparing, I was searching and how is situation. For example, in Germany, I got surprised. Now it's every day more than 70,000.
Yes, it's just started, I guess, from last week. A lot of Germans they had a holiday also in South Africa, or South Africa, and they want to come back now. So
It's
it would be
risky.
a very coming in. But although there are some cases in München that they already found out.
Really? You mean the new Omicron case or the just new cases?
No, no, it's new cases are there.
Okay,
But the new variant cases, I guess it's the one that they're looking for now.
Right.
But that's a scenario for now. They're looking for the new cases from the South Africa. A lot of tourism, and Christmas market is there.
Yes.
There's always a question that then they need to change basically between the quarantine and also leaving the people.
I mean, it's similar like the Delta variant at the very beginning, but this one is Omicron. It seems even more dangerous. It has more number of mutations than Delta, and it has like some very specific place of mutation is quite risky, and so it's very contagious, so to say, in South Africa, and the number of infected people like increased very fast. Like it might took data for months, but it only now take Omicron for weeks.
Any new information about which countries they have the new variant yet?
They have identified in Hong Kong, in Belgium, in Israel, in UK as well, I think, from what I read. I think, I mean, since now, I mean, it's identified like days after it appears, so I think now it's already get spread to a lot of places, and it's difficult to identify.
I guess the only factor that's really important for everybody is just to take care of themselves in case of getting the necessary vitamins to make their body more powerful in case of the immune system and so on. I guess in that sense it should be. I don't know if that's the. Do you have any information if, for example, is a really variant of the coronavirus or this is some new virus or something like that?
I mean, there are different theories. I think the scientists are still analyzing what is it exactly, but it is a variant from the coronavirus. So from alpha to beta to delta, now it's Omicron. But there were theory how it comes from. I mean, where it happens, and the most scary theories it is get mutated with the AIDS virus, so it has some ability to get rid of, to escape from the immunity system in the body. So that is the most scary theory I have read. We need to see. But I mean, even with the information now, scientists start to worry about all the vaccines now in the market cannot really be effective for the Omicron, this new variant.
But I couldn't find any information about the percentage of the rate that it can infect people, because I don't know if the information released, but at the time for COVID, at least they guessed some infection rate. So basically, you know that how likely it gets to the wall. But for this one, I didn't find any data yet. So
Yeah,
I don't know if
me
it's
neither.
really as important as COVID.
Yeah, me neither. I think it needs some time to get the most accurate number, but the WHO tagged it as variant of concern because the number of new cases in South Africa increased quite rapidly in the past few days, and there were some estimations saying 75% of the new cases are the Omicron. Yeah, but normally, if a virus is more contagious, so if it's more easy to get infected, normally it's less fatal. I don't know about
Yes.
this one.
And the another one was actually the reaction of the Bitcoin and the stock market. the resulting values are just deeply decreasing
Yes.
because of the worry about the new variant. And you can see, for example, from the Bitcoin side,
Yes.
the price just decreased in 1 or 2 days from 52,000 euros to 47,000 euros, something like that.
Yes. Yes.
And also, you could see exact immediate effect also in the stock market.
Yes.
Decreased. Basically, Dow Jones decreased 4.2%.
Yes.
So
It's I am losing more money now.
we have also the comment that this Kimi also mentioned that it spread faster than stock time, so it's also higher.
Yeah, right. That is why it's get a lot of concern now, and because for data it takes WHO months to like define it as variant of concern, but for Omicron it only takes days. So
Yes.
right. When is it going to the end? I have no idea.
Hopefully soon. That's the case.
I think most probably at the end, human beings have to live or coexist with the virus, most likely. But it will take time for human beings to be ready.
Yes, I guess if it tries to act exactly like a flu, eventually it will fade out by just mutating to the wrong form.
Yeah.
Because last time, I guess, human didn't do anything except waiting for the virus to be faded out automatically.
Yeah.
But it seems until now, vaccines. I mean, there's a point for the vaccines when some countries, because of the political reasons or because of the lack of reachability to the wall or something like that, they cannot really be provided with a vaccine in the specific time. They put it on a 6-month time period, so on. Just global immunity is not really a solution because simply some countries they cannot reach the vaccine. And for that, it means that the people who get the vaccine, then they get more immune. It means that they need to take it regularly after, I guess, every 6 months or something like that. But for the people who doesn't get the vaccine, it means that always a chance that there would be some hazards come to their life. So it's a weird situation, I would say.
Yes. I think the point of vaccine is actually to help you be ready before you get really infected.
Yes, exactly. I mean, there is always huge discussion that if vaccine should be mandatory or something. I guess those discussions are a bit taking too long. they need to come to the conclusion sooner. Otherwise, I mean, there could be more mortality and so on. So if anybody also wants to ask questions, please also write in the comments. And anybody listening, yeah, don't be stressful. It's just take it as easy as possible, because one of the important factors for the immune system that's always they mention is that to keep calm and relax, because stress can reduce the effectiveness of our immune system.
Yes.
And that's the important part.
Yes. All right. And we talked also last time how to get relaxed, how to stay happy when you're in quarantine or when you're in the situation like this. You can raise a pet.
Yes.
Or you can raise a baby.
And even even with all the variants, you can also go out. It's really important to go out, to have a small trip around your city and so on. Because anyway, when you're in a car or when you're walking outside, something like that, the probability of getting infected shouldn't be that high. If there's a gathering, yes, that's usually the risk. Here, the Christmas market just started. Maybe next week we talk about the Christmas market. And
but I heard in Germany in some cities the Christmas market are shut down because of the number of cases are increasing.
That can be the case. That can be the case because of especially South Germany. That probably is the case. But here, still everything going on. Usually the Christmas market is until, I guess, 2 weeks or something like that. And they expected all the travelers from South America to come here, I guess, during the next 10 days. So the effect will appear most probably after the Christmas market. That's my guess. In case of, the normal COVID behavior, if you, get infected, usually you get some signs after 1 week or 2 weeks. So it could be that New Year could be a bit, the number of cases could be higher than that. Now even it's the highest number in Germany in total in all the years, 75,000 people, new cases. But the mortality rate, the people who died, was about 350. So compared to the 2,000 people who died last year with the less number of infection before, it means that the vaccination really helped. Yep. And most of the people who died, they didn't get vaccinated.
Right. I also read like now those vaccine companies already started to work on how to adapt the vaccine to make it effective to the new Omicron variant. So if they work hard and if we are lucky, then we can have new vaccines for it. I think in this or maybe early next year.
I guess the way that they produce vaccination, they already have some clues that what would be the process. Hopefully, the new variant also has some similarities that they can reuse all the research that they did before. Yeah. So, in principle, they should get the vaccine much sooner than before, hopefully.
I think the most of the time it takes is to do all this validation, this test before it goes to market. Normally, I think in US it takes years. If you want to produce a new vaccine, but now it takes less than 1 year or around 1 year. So the whole process is get shortcut. To make sure the vaccines, effective ones, can get onto market as soon as possible. So that is a positive side.
I guess the vaccination process, all the medical care in general, the average of the people who are now taking the healthcare measures and so on, they're increasing much more than any years in the human history, I would say. So that's why you couldn't see a lot of influenza this year, because of all the taking measures that people they made. That's a really, I would say, that pushing to the better future, because in case of the healthcare measure, a lot of people now are aware that what would be the the ways that they can get infected and they need to take care of themselves. The another way is actually online courses and online meetings and online workplaces. Now every country they push to have this system, such system, including Germany. I mean, they were really resisting with the new technology, and they always wanted to have papers. Now it's really weird now that they accept even a scan of the papers over the email, and even when you sign the digital signature as well. So that was one of the breakthrough in Germany to accept not in person rather than sending email. You can send them email and document or someone.
Yeah.
Or even ask them via email that some works should be done, and they do it. And usually they don't do it. They need to see you in person.
Yes, yes.
I guess that's a positive side of all this long time COVID variant that's being in place. I mean, for the health, for the mental health, of course, it has a disadvantages. But in case of the technology progress, I would say that it was a push.
Yeah, I think so too. I mean, before in business, B2B, so many companies they used to resist to this new digital transition. But now they have to do it. They must do it. Otherwise, the whole business cannot really work.
But the new variant, also in Israel, they mentioned that all the travelers from the outside Israel will be banned to come to Israel. So they need to probably take a really high measure in order to check if somebody has the new variant.
You mean where?
In Israel.
In Austria?
No, Israel.
Israel. Okay, Israel. Right.
I guess usually they take it really seriously. In Netherlands, they also did some very limited amount of quarantine. In Austria, they did quarantine. In Germany, not yet. They started to do some suggestions, but not really the heavy measures yet. Although they're talking about 2G plus measure, it means that they mentioned it by 3G, 2G, and so on. It's a it's vaccinated, somebody gets healed, get tested, get released, and gave. That's a 3G. And the 3G status means that one of the conditions is that if you get vaccinated, you can enter the restaurants and enter the meetings and so on. But they try to make it 2G plus. It means that the people who got vaccinated and who got healed from the COVID, so basically if they want to go to restaurant or some meetings, they need to also get tested. So in principle, people who didn't belong to these two groups and they just tested something like that, they will not get accepted to those meetings.
I
so
see.
They'll be totally out of the option. Measures that may come in future. Yeah.
What is the third G about? So you get vaccinated and you get what?
You get recovered from COVID.
But what if you don't get any? I mean, if you have never get any COVID infection.
So this is the 3G. It's the third one. If you get tested. Talking about the 2G, it means that the third one, the person who didn't get any COVID before, also who didn't get any vaccination, they're not allowed to go to anywhere.
But how can you show it? I mean, how can you prove it when you want to go to a restaurant, for example?
We have the online COVID pass.
Okay.
See, you show the QR code, and they take your code, and that shows that either you get vaccinated or have this antigen test. So basically, you already get. Then they check your name with your, of course, passport or any other official documents, and then they allow you to come inside and sit in a restaurant. Otherwise, you need to take your food outside.
Okay, I see. That is very, very similar as what in China. I mean, we have also. I cannot show now because I'm using my phone, but we have also a QR code to show you. It has a record like whether you get vaccine, but you have also a QR code to show whether, for example, you have to pass by any high risk area. I mean, even if you are not infected, or if you are not get any fever or any thing like that, but as long as you have passed to a high risk area, then you will have your QR code yellow, for example, or even red. Then you cannot go to hospital or go to public places like that. I remember when I first last year when I got back to China, and when I landed, my QR code becomes red immediately. I don't know how they do that, but now I got 2 weeks vaccine. No, two. I was quarantined for 2 weeks. Then the QR code got green. Then I can leave.
It's a really nice concept. The other cases that I mean, it's weird, right? I mean, to know that exactly. I mean, to show you exactly that they know where you are and which people you get in the vicinity of.
Yeah, that is strange. That is strange. But although I know for like social, I mean, for this company like Facebook, they want to connect people. They must love this idea. So you know who is around you, and you want to make a friend, and you add each other friend in Facebook, for example.
Yes, that's actually one of the concepts that is in place. Basically, those companies, they enable the government to logically provide the argument that why they need to take track of the GDP. That's the different topic. I mean, that's a scenario. Then a lot of different information can be revealed from your side. That's I mean, at which time, usually where you are, if you have the very abnormal behavior in your places and so on, and there's some weird things happen in that place, then they check that who did different behavior, or who is the new person comes to the area which that person never came before. Yeah. And this kind of things.
Yes.
I guess that's also is the other side of the COVID. That a lot of countries, they try to track. And they may use the information not just for the COVID, for something else, but I guess that's all the countries, they have it already.
But in China, once a new case is identified, I mean, then it will be published. So it will be published in media, like where this guy has traveled in the past few days. I mean, it's very detailed. Like for example, today morning I went to school. Today afternoon I went to a coffee shop. Then people who has passed by those places can get notified, or they know they might need to do a test, for example.
Yes, exactly. I mean, the information that one thing is that all the things can be tracked in case of the spreading the cases. I mean, in some cases, it's also fantastic in case of getting to know exactly how one virus can be spread over the time. Although, I mean, when it gets more details, and there's a concept of the privacy and so on. But in case of just, if we talk about the COVID, really practical and nice model that viruses, they can get spread from, which usually, I mean, what is the probability of those spread rates in different places? I mean, based on the assumption that we think that always the spread rate would be higher in the gathering part, either in restaurants or some concerts or I don't know, in some places like a museum and so on and so on. But it would be nice to see that what is exactly the rate, because at the time people talking about when the COVID came that the restaurants are really dangerous, especially when you want to eat food. But at some point they came to a conclusion that actually food is not really the main source for the spread. And they said that if the foods are warm and they cooked in a restaurant, usually they're safe. And those are the concepts that's I guess you can probably get more information from those data.
I think many people nowadays love takeaway food or order from online, but sometimes you can detect the virus at all face of the packages, and some people got infected because of that. And I mean, and now because in Shanghai 3 new cases are identified, my parents they called us and tell us, okay, you must clean what's the word? So clean the the surface of your package when you want to open it. And I mean, in China, people are very, very cautious about COVID-19. I mean, I know my parents, they miss their grandson a lot. And they plan to visit us next week or the week after. But now there are 3 cases now in Shanghai, and they said they need to wait. I mean, you can see, I mean, in China, whenever there's even 1 case find in big city like Shanghai with like 30 million people, I mean, all the people get cautious and nervous, and they need to plan their traveling very carefully.